Doctors, tell us about your dumbest patient. Once I was brought a child who swallowed quite a large magnet. It ended up in his intestines, so we just had to wait for the kid to pass it. The next day, he was brought back, and they said he swallowed another magnet. It turned out that the second magnet stuck to the first one through the wall of the stomach, leading to intestinal obstruction. We had to send him straight to the operating room, where they were surgically removed. A patient comes to me with abdominal pain and says, "I think the problem is in my gallbladder." I look at his medical record and see that his gallbladder was removed 20 years ago, so it's impossible. I tell him this. His response, "Yeah, but maybe it grew back or something." A patient comes to me with her mother. The mother asks me to fix her daughter's scrotum. Me trying not to burst into laughter. "Fix your daughter's scrotum?" To which she reacted as if I was an idiot here and pointed to the back of daughter's neck. I knew there was no point to correct her, as she wouldn't listen to me anyway. Plus, I wanted her to keep walking around and telling this to other people. I've already posted this before, but the case is too good not to remember it again. A couple. A 20-year-old girl and her fiancé come to me. It turns out she is pregnant. Me, looking through her history, "Do you smoke?" Her, "Yes. About a pack a day." Me, "You definitely should quit smoking." Her, "Really? My sister told me that if I quit now, the baby will go through withdrawal and could die." Me, "What?" My dad is an orthopedic surgeon who often performs knee and hip surgeries. He has a favorite story that always makes him laugh. Once they brought a woman who didn't understand how surgery works so much that she decided that for the operation on her hip, they would have to first amputate her leg and then sew it back on. I blame Barbie dolls for this. My work is closely related to eye surgery. Believe it or not, about 25% of patients think we remove their eyes during surgery. Listen, I'm a busy person. How about I just leave you my eye, and I'll come pick it up in a week. I know a guy who went to the doctor fearing he had cancer because once he scratched his eyebrow and a few hairs fell out. Darn, it looks like I have cancer too. This is doubly dumb because hair loss is not a sign of cancer, but a side effect of cancer treatment. My mom works at a hospital and constantly feeds me amazing stories from X-ray technicians. Last week, they had an adult man as a patient who inserted a huge carrot into his rectum. The guy came from some very conservative village. He stood leaned over during the 3-hour trip because for obvious reasons he couldn't sit. If I ever decide to change profession, I'll definitely go into radiology. I work in the emergency medical service. Called for a stroke. Patient with a distorted face and speech impairment. She says her sensations are the same as during a stroke 10 years ago. Further, she specifies that the symptoms appeared 4 days ago, and that she already knew she was having a stroke back then. I ask, "Why you didn't call us right away?" Her, "I hoped it would pass on its own." Once, I had to explain to a 17-year-old girl and her mother that she didn't have an alcohol allergy, just a common hangover. Her complaint was that sometimes when she drinks a lot of vodka, especially on an empty stomach, she experiences nausea, flushing, and vomiting in the mornings. She didn't have any other allergy symptoms. Wait, there are people who are allergic to alcohol? Yes, indeed. Source. To knock out my mother-in-law, all you need to do is give her a little beer. 2 stories immediately came to mind. One from me, I am a clinical pharmacologist, and the other from my colleagues at the emergency room. The first story is from the emergency room. They brought in a 16-year-old boy with a massively swollen penis, losing its natural color. It turned out that the guy was stealing his mom's insulin and syringes, taking blood from his own arm and injecting it into his penis, hoping that the blood flow would help him increase the size of his manhood. In the end, this led to a powerful infection, which resulted in him being hospitalized for a week. The second story, a girl comes to our pharmacy and asks for birth control pills. I check her in the computer and see that I can't give her more because less than 2 weeks ago she already took a pack intended for 28 days. When I asked what happened, she said she ran out of them. It turns out she was taking them, together with her boyfriend. They thought it was pills for both of them and that this was the only way to avoid pregnancy. Once, a grandmother and mother brought their daughter or granddaughter to the trauma center with a complaint of bleeding. However, the bleeding was not due to injury or bruising. The girl had started her period, and her mother and grandmother didn't want to explain what it was and that it was normal, even though they both understood what was happening. The upside was that it was a very quick visit to the trauma center. A 24-year-old inmate from some rural prison was brought to us once. The dude was working on the roadside, found a bottle in the ditch, and decided to drink its contents, hoping it was alcohol. Honestly, I would have thought it was whiskey too, but no. It contained some substance with sulfuric acid. His blood pH was below 2.5. so he easily passed the litmus test. As a result, he ended up in intensive care with excruciating pain and bloody vomiting. A gastroenterologist performed a gastroscopy for him. This procedure involves inserting a tube with a camera to look at your esophagus, stomach, and duodenum. The picture from the camera was simply terrible. You could literally see his stomach and esophageal mucosa being eaten away. It was decided to move him to another hospital, where a surgeon capable of fixing such hell was found. The guy had to undergo multiple surgeries and stay in the hospital for some time. He was lucky to be young and healthy, however, not very smart. Otherwise, I don't even know what would have happened. A few months later, he ended up with us again with some other problem. I don't know what happened, but he went from 68 kilos to 41 kilos, and I saw him being fed through a tube. The guy came to the outpatient clinic with a swollen left testicle and started explaining that his girlfriend, with his consent, injected oil there so that he could last longer in bed. It was extremely difficult for me, a female intern, to hold back my emotions. When I introduced myself to the patient, I said that I would be his anesthesiologist, to which the patient replied that he did not want me to be his doctor because anesthesiologists are not doctors. Not long before that, there was another guy who asked me if he needed to go to university to become an anesthesiologist, and another one asked if anesthesiologists need to know as much as a pharmacist. Why are you checking my thigh? I told you my knee hurts. I don't understand these people. When I go to the doctor, I explain what's wrong with me, and then let them do whatever they want to me. My knee hurts, but the doctor says they need to check my buttocks? Okay, no problem. Here's a story from my friend who is an oncologist, gynecologist. He had a patient with early uterine cancer. When he suggested surgery, the patient refused and decided to try alternative treatments, such as coffee enemas, meditation, and other nonsense. She even somehow reached the Dalai Lama with her problem, who advised her to go back to her doctor. I am a dental student. One of our patients is a pathological liar. He sometimes boasts that he is studying medicine. Then he says that he was a dentist in the army. And the last time he told us that he has a doctorate. This patient constantly spouts nonsense like, "Hey doc, how should I turn my head? Distally or medially?" No, I need you to turn your head to the right. "Hey doc, are these holes in my teeth due to anaerobic microbes?" No, it's because you eat candy and don't brush your teeth. A woman came to the emergency room and demanded that I prescribe antibiotics for her. I told her that they are not prescribed for viral symptoms, but she insisted so much that I had to give her a small educational program on viruses, bacteria, antiviral drugs, and antibiotics. Hopefully, it helped her pass her exams. I forget to mention that she was a medical student. A 20-year-old girl came to me with abdominal pain. I gave her a pregnancy test. It turned out she was pregnant. There was obvious surprise on her face because, according to her, she was taking contraceptives. I asked her how long she had been taking them, and if she took them daily, as prescribed. She replied that since her sex life was not regular, she did not take the pills every day. I looked at her, barely holding back laughter. It turns out she only took them after a night with her boyfriend a couple of times a week. Such stories really saddened me. She just wanted to do everything right and was not given the proper education on this matter. I agree. It's both funny and sad. The doctor who prescribed her the pills clearly didn't bother to explain how to take them. Oh damn. Here are a few idiotic cases from our emergency room. The first one, a woman came to us because she was stung by a bee. There was no allergic reaction, no problems. She just has a sore arm. Second, another woman brought her child because he was stung by a bee. Also, not an allergy. No other complaints. Third, a whole family came to us once because they found a dead mouse in their house and were afraid they were now sick with something. Fourth, a woman came with a complaint that she has a second-degree burn on her arm. The wound was the size of a Tic Tac. Fifth, once a woman spent 5 minutes telling me that dog vaccinations lead to canine autism. I'm an ophthalmologist. Told the patient that he needed reading glasses. He could not believe me. So I explained to him that there was nothing wrong with that, as presbyopia, old eyesight, appears over time in everyone. His response, "Oh, come on! I haven't heard that George Clooney needs reading glasses." Well, first of all, he really needs them. Secondly, I don't understand why you're even comparing yourself to him. Oh no, 25 years ago, when I developed nearsightedness, I was in a similar situation. My ancestors did not allow me to wear glasses indoors because they believed that the eyes would heal themselves and the nearsightedness would disappear. As a result, I had to squint all the time, and the nearsightedness, of course, did not go away. Moreover, over time, it only got worse. Oh my goodness, it's my time to shine. First, a guy brought his wife to the emergency room. She had an ulcer on her leg, 7 by 7 centimeters, diabetic foot syndrome, from which yellow-green pus with some larvae comes out. I quickly examine her and send her to the surgical department. The husband starts insisting that we should first check her kidneys. "Doc, it's just a wound. First check her kidneys." I read on the internet that due to diabetes, they can fail. Do something about it. I had to spend an hour explaining to him that his wife is more likely to die from sepsis than from failing kidneys. Second, I was examining a child with measles. His parents, staunch opponents of vaccinations, were sitting next to him yelling at me, "Why the fuck does modern medicine still not have a cure for measles?" I tried to explain that there is actually one preventive measure that they decided not to use. They're like, "Which one?" Me. Well, he could have been immunized. They. Are you from the pharmaceutical lobby too? Yeah, whatever. I'm a pharma lobbyist, wishing death to children. Thank you very much for watching, and doctors who are watching us, write here in the comments on YouTube about your dumbest patient, and don't forget to watch our other episodes. That's all, bye.